9/11 community is deeply concerned about the future of the World Trade Center health program. Let's bring in two veteran firefighters and union bosses, Jim Brosi, president of the Uniformed Fire Officers Association, and Andrew Ansbro, president of the Uniformed Firefighters Association of Greater New York. Gentlemen, thanks for being here. Andrew, I want to start. Yeah, absolutely. I'd love to have you here every year to draw attention to a very serious issue. Andrew, let's start with you. On Tuesday, the FDNY added 39 names to the World Trade Center Memorial Wall. And let's take a look at it because it's in honor of those who died due to 9/11 related illnesses. And Andrew, 402 names now on that wall. And you know what strikes me as I look at this? Look at the room left for more names to be added.
Absolutely. The wall isn't half filled based on their estimations. And we know that there are thousands of firefighters still affected by the effects of 9/11 and what's going on. We're losing approximately 3 members a month due to 9/11 related illness. We have a member in hospice right now. It's ongoing and never ending. And the fact that we have to keep fighting for the World Trade Center healthcare program is very disheartening.
It's very disheartening, especially this time of year. Jim, your father's name is on that wall.
Yes, he is.
Joseph Brosi succumbed to 9/11 related cancer a couple of years ago. He was 78, lieutenant firefighter. Your dad was a hero. Tell us what it's like for families who are struggling even as we speak.
I would say it's a bit of a daunting process because not only does the diagnosis seem dire, it's working your way through the program, getting the authorizations, constantly either going through treatment or testing. And unfortunately, even for my father, who had a very good, I would say, process through his cancer recovery, it was an 8-year-long battle, waiting from test to test or treatment to treatment. And, you know, as we look at these walls, we see the names, and I don't think the names tell the full story of the true suffering. I think when people look at the people lost that day and then the people lost since then, they don't see what people are going through just to stay alive since that event.
Yeah, and the tragedy continues 24 years later. Andrew, how would you describe what's happening in Washington, the climate in Washington? You were both here last year. It's a new administration now. What's happening at the health department is very controversial under the leadership of Robert F. Kennedy Jr. You know what's going on. Tell us.
Absolutely. Well, the end of last year, we had an agreement to get the funding package in the bill to have the World Trade Center healthcare program funded till 2040. And at the very last minute, Elon Musk put the tweet heard around the world, and that killed the continuing resolution. And since then, we haven't been able to get our bill back into any larger government funding bill. So we've been fighting back and forth in Washington trying to get that bill attached. And aside from that, as you mentioned, the Health and Human Services Department, led by Kennedy, has put several cuts on several different departments that, unbeknownst to him, it affected the World Trade Center healthcare program. But they've claimed that they've put everything back where it started, but unfortunately that's not true. Right. A lot of doctors took buyouts because they were trying to downsize staff. Staff is down by 15%. And they have a hiring freeze. So people that walked away from jobs, the jobs can't be filled. Those are researchers. Those are people that write grants. And we can't get grants done, we can't get research done. But at the same time, they also have a blackout on communications with World Trade Center related advocacy groups. And we have people with illnesses that we're trying to get verified that they are World Trade Center illnesses, and we can't get the research done to make that connection to have these diseases and issues added.
Yeah. And Jim, you know, in the morning, thousands will gather. You'll both be there in Lower Manhattan for the reading of the names. And again, 24 years later, both of you are part of a small but mighty group that's keeping the pressure on lawmakers to keep their promise and never forget those who risked their lives on 9/11. What's your message, Jim, to officials who will gather there who are not really doing anything about what's happening?
I think my message would be it's not enough to just show up on 9/11. It's not enough to just read the names. It's not just enough to build a monument. You need to keep the promise that was made to every one of the responders, the people that lived in that area, and volunteers, that you will not only provide them the health care, you will provide them the research that's required to make sure that the best treatment and detection is possible.
Jim Brosi, Andrew Ansbro, veteran firefighters and union bosses with the FDNY. Thanks for being here.
Thank you for having us and letting us tell our story.
Absolutely.
Thanks for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest news and weather updates every 10 minutes, and more. We'll see you then.